This is a series of tests that goes through testing for posterior instability of the glenoid fossa. And so what we're going to do is we're going to have our patient in supine for all of these positions. I'm going to abduct her arm to 90 degrees. I'm going to use my knee to support her elbow at 90 degrees, keeping her external and internal rotation at neutral. I'm then going to use the Spock sign. My ring finger and my pinky will be on the glenoid head, humeral head, and I'm going to use my other two fingers to palpate the labrum. I'm then going to put her arm in between my body and my arm, and I'm going to apply a posterior glide so that both of my hands can do this. If there is any apprehension or pain, that is a positive test for the posterior glide at 90 degrees. Then I'm going to bring her into neutral position. I'm going to have her shoulder flex to 90 degrees, no abduction. Her elbow is going to be relaxed at 90 degrees of flexion. I'm then going to push posteriorly. This is why it's important to have them off of the side of the table so that you can get that posterior capsule to move. And at this point, if there's any popping, clicking, or pain that you can feel, or laxity, that's positive. And then from this point, you're going to still apply that posterior pressure, but you're going to horizontally adduct their shoulder. And what you're going to do is you're going to palpate back for the humeral head, feeling for any popping or clicking or the humeral head popping out of the joint. And this is called the jerk test. And then when you bring her back into neutral, it should pop back in. And as I said before, all of these tests are for posterior capsule instability of the glenohumeral joint.